All right, welcome back to Morning Live. As I mentioned earlier, before we took a break, Dr. Grace Mbatia is with me in studio, and we want to focus on pediatric oncology. Simply means cancer in children because it's so actually uncommon. But today we want to talk about even solutions. Let's be solution oriented, because as much as young parents might not understand what's happening, the symptoms, those things are really you need to spot earlier before now it goes to some levels where it's uncontrollable. Dr. Grace Mbatia, good morning.
Morning.
And good to see you today.
It's good to see you, Nick.
All right. By the time someone kind of just understands pediatric oncology, I've simplified it to cancer in children, but still you can give us a more detailed just definition of pediatric oncology.
Actually, Nick, you've been spot on. It's exactly what you've mentioned.
Okay.
It's a group of diseases which are malignant, meaning that we have cells which are dividing, and I think I put it in a way without control.
Okay.
And as just like you have breast cancer in adults, and I tell this to parents a lot of times, is that you have a cell which is dividing and then you find a lump. So it's pretty similar in children.
Okay.
So it is cancer in children, and it does happen. A lot of people get surprised and say, does this really happen? And it does. It's more rare in children, but it does happen. But as you said, I'm happy that you said we're focusing on solutions.
Absolutely, sure.
It really is. The beautiful thing about cancer in children is that most cancers in children are actually treatable.
Wow.
Yeah.
Wow, that's good. And you see, at some point, adults think maybe it's only us guys who kind of are attacked by cancer, but still, how does this young baby, he or she hasn't finished even a long time on this cruel earth, I must say that, and just kind of get cancer? It's kind of mind-boggling also.
Yeah. So I'm glad you asked that, because children are not little adults. They are unique in their own, they're unique beings. Yeah. And if you think about it, a child is formed from, the union of an ovum and sperm. And from that little one cell, that has to divide very rapidly, and you have to replicate your DNA, and you from that little one cell to the age of about 1 year, even to the time the baby is being born, there's a lot of duplication of cells. And when we duplicate our cells, we have to duplicate our DNA. And I don't want to get too technical, but you can imagine every time you're duplicating, you may have some errors at that point. And that's what we call mutations. And a lot of times that is where cancers would arise. And even if you think about the period of childhood from birth to 1 year, and even during the growth spurt, when we have our teenagers just shooting up and growing taller than us, those are periods of very rapid cell growth. And we've said cancer are cells that just are rapidly dividing and dividing and dividing. So they're very, very different from cancers in adults. These are people who haven't been on earth very long, so they haven't had a lot of time to mess up in terms of, their tobacco use, their alcohol use. So people do get surprised. But again, these are not little adults. They're unique in their own way. A lot of their cancers are not due to environmental exposures. So it's important for people to understand that it does occur, but it's a whole different ballgame. It's not the same. You're not dealing with the same animal.
Okay. Now, there's so many types of cancers. And for example, a parent wouldn't identify what's happening to the kid. And by the time sometimes people go for misdiagnosis, so many things happen in the verge of just trying to maybe see this malaria or fever or what's happening. So by the time you realize it's cancer, sometimes too late. By the time now the treatment starts, also you've spent so much money, time, resources. So maybe it's always good to now tell the parents out here that indeed there's some signs that are open, just to know that this one you need to go take the cancer direction. Don't take that malaria culpable direction, fever, those things. And some parents really complain of misdiagnosis, because so many parents, by the time they now bring the child for the whole process, they've complained big time, like misdiagnosis, and of course spending so much money.
So you've mentioned several facets of a very complex problem. And you're absolutely right. A lot of children come to me pretty late. The great thing about children, again, is they are treatable. A lot of the times the situation is salvageable, but as you've said, a lot of money has been used. But let me start by saying that it's not the most common condition, and a lot of the symptoms that children will present with have a lot of overlap. Okay. So it is true that they do present relatively late. So I think the onus is on us to be more proactive in educating people, making them more aware, saying to them, cancer does occur in children, and that's not only to the general public, but even in the medical fraternity, is to have people have a higher index of suspicion, because a lot of children will come to me admitted for several weeks, and in pretty high end, in pretty high end private hospitals with and it's just because you don't see, your brain doesn't sort of you don't see what you're not looking for. If I send you to the top of a mountain to look for some exquisite flower and you don't know how it looks like, you'll be running around looking, and you might walk right past it and you might not see it. So I think the onus is on us really is to be more, as pediatricians, and especially in the small fraternity of pediatric oncologists, to be more proactive in educating people. So to answer you, and I think if you'll allow me, please let me just say, because I find a lot of parents really angry, that they came to me pretty late and they say it was misdiagnosis and there was this and that. But the thing is, they also blame themselves. Actually, they blame themselves more than they blame the medical fraternity. So if you'll allow me to just say to the parents who may be listening and who have a child who they blame themselves, they say, I've been sitting on this, it's my fault. Please don't blame yourself. It's really not your fault, because a lot of parents really do blame themselves and spend so much time and energy blaming themselves, aside from blaming the medical fraternity. So children, cancer in children, it's not preventable. You can't, there's nothing you could have possibly done. I have moms asking me, did I eat the wrong food? Should I have eaten less meat? Should I have not taken coffee? There's this one time I went drinking with my girlfriends, and I tell them there is really nothing you could have done to prevent this illness in your child. So I've said a lot, but what I would say is, if you find there are some symptoms that are worrisome, if you have, and a lot of in this age group, for those who have young children and you send them off to kindergarten, they always have this homas. They share crayons and they share homas, so they have these fevers on and off. So I don't want to cause panic and have parents coming to the casualty worried. But if you have a child who is generally not playful, is fatigued, because little ones, that's their job, they play. So if they're fatigued and they're not being their usual selves, moms will usually say, well, this one is off. And we take that pretty seriously. If they're having fevers, these recurrent fevers, and you're just sort of always in casualty, always getting antibiotics, this child is losing weight, the most, solid tumors. So we think of cancers as hematological malignancies, which is very common, the leukemias and lymphomas, which are disorders of, the blood forming cells. And then solid tumors, so like tumors of organs, like of the liver, of the kidney. The most common is something called neuroblastoma of the nervous tissue. So those ones are sort of easy to catch, because it's a lump, and everybody knows if you have a lump, that's not a good thing. So if you find that you have a child who's complaining of odd things like backache, children should not have backache. If they're having this constant limp, and that's the difficult thing about pediatric oncology, is that common things occur more commonly. So if you have a fever, it's probably that you went to school and you had you just have an upper respiratory tract infection. Or if you're limping, it's probably because you were playing soccer and you fell. So it's probably not a cancer. If you're bruising, that's a bit of a worrying sign, because that could be pointing to so there are lots of things, and there's a lot of overlap, and that's where the challenge comes.
Sure. when you talk about pediatric specialists, you know, at the same time, people have been trained for so many years, a maximum of 7 years. By the way.
It's actually a bit longer.
Yeah, maybe longer, maybe 10 years as a pediatrician. And it's unfortunate when someone doesn't really understand what's ailing this kid, because now by the time you say it, parents are blaming themselves. It's unfortunate also. They couldn't have prevented it actually.
No.
Now, but as a professional, what goes wrong? Like trying to identify what's ailing this kid, because I think as a professional, you should understand that there must be something here. Go for this test, that test, and that test. So what happens here, maybe? Because now, by the time a parent comes to you with misdiagnosis, spent a lot of money, that means frustration also.
There's frustration all around, but I liked your opening statement that we'll focus on solutions. I like to focus a lot on solutions, because then if I focus on the problems, I wouldn't manage to do my job. So one of the other big things that I do is I educate. I spend quite a bit of my time educating, and that's nurses, pharmacists, mostly residents. I think before we started the interview, I told you I spent some time in Kenyatta, and that's one of my passions. I really love to teach. And I always say to people, if I drop dead, I don't want to go to my grave with everything, right? So we need to educate. I think there's power in education. I don't think there's anybody who goes to work and says, you know, I'm going to sit on this child with cancer and I'm not going to, I'm going to just milk them dry and I'm not going to send them to the specialist in time. I think it's just goes back to you don't recognize what you're not thinking about, and that's why I said I think the onus is really on us, is to educate more and to advocate more and to let people know. That's actually why I agreed to come, because I don't like to come on air.
All right, just hold on right there. We take a short break. When we come back right in Morning Live, now you focus on the treatment. We focus on the symptoms, because at the end of the day, as I mentioned earlier, the kid might be having this fever, some sporadic just rashes. You don't think, it's a normal rash, it's something happening. But still, when you go for diagnosis, things happen again. Sometimes people get it right or wrong. And then now we'll be talking about expensive treatments, also those sort of things. So when you come back, Doc could be giving us now the symptoms, because as she mentioned, there's so many types of cancers. After a short break, we're coming back with all that. Stay tuned to Switch TV. Right, welcome back to Morning Live. Treatment of cancer in children, pediatric oncologist is here in studio. And it's unfortunate that still we talked about some misdiagnosis, but let's now move on to solutions. But Star, now, without a solution, you know, there might be some brushing of shoulders here and there. But you know, doctors really do a lot of stuff, and let's focus on types of cancers first before the solution, because now I can see the leukemia, there's so many things. You mentioned something like a neuroblastoma, all those things. And by the time now this realized, I understand parents can pick some kind of symptoms from this. Maybe you can give us just the most common cancer in children and the symptoms.
Okay, so the most common cancers. So if you think about it really broadly, you can think of them as the liquid cancer, so sort of the blood or hematological cancers. So that's leukemias, and there are two types of leukemia. There are two main types of leukemias. There's acute lymphoblastic leukemia and acute myeloid leukemia. And under the hematological malignancies, there are lymphomas. And the most common in our neck of the woods in this malaria endemic zone is something called Burkitt's lymphoma. And I think for those people who've visited the cancer wards for children, you know, it would present as sort of like a mass on the jaw. It can present as an abdominal mass. It can present as lymph nodes, very large lymph nodes on the neck and in the inguinal area and in the axilla, the armpit. Sorry, I'm using jargon. But, you know, if you think about the leukemias, what it basically is you have these abnormal cancer cells that are multiplying and they're in the, usually when I'm explaining to children, because I do talk to my patients directly, and I say to them, there's a problem in the factory that makes your blood. Okay, so then they can understand, and then I ask them what they like, and they give me whatever example they give me, and I tell them, well, that factory is now been invaded by something, and they give me an example of what they don't like. And so then the factory is not working very well, and so what ends up on the shelves, which is in your blood, doesn't work very well. So we have three main types. I don't want to get technical, but we have three main types of blood cells. We have white cells, which will act as your defense. So a lot of, it's kind of like your Air Force, your ground forces, your Army, your Navy, there's some of them really specialized, like your risk squad, okay? So at least then the child can understand that that's my defense. So those guys are not working well. So I'll tell them, you know, so you can imagine a country that didn't have defense forces. So how would that look like? So, or will be invaded by everybody. So that's exactly it. So they get a lot of that's why they get infections, okay? So, you know, these repeated sort of infections, these fevers that are not sort of settling. There's a mom who told me mtoto aleti shangwe. So, you know, they're just not well. Okay, so they have all these infections. And then we've sort of talked about your defense, that's the white cells. And then you have your red cells, and they have hemoglobin. A lot of moms who've carried pregnancies, they know we keep checking their hemoglobin levels. It carries oxygen, carries carbon dioxide away. So they're just very lethargic, very tired babies. So you should have a toddler annoying you, trying to do everything, you know. But when you have a little one just sitting in the corner and they don't want to be bothered, that's not a good sign. Okay, and then we have our platelets, and I'm being really basic. We have our platelets, which, you know, if you cut yourself, even if you don't have a bandage, you'll just some sort of form a plug, right? You'll form a clot. So if you have, if you're bathing your baby and you see that you just have this sort of, that's what, at least I'm telling you what the moms tell me. It's like they've been beaten, you know, they have bruises all over. It looks like someone took a pen and like really, so they have these really small punctured bleeds. We call them petechiae. So if you have this bruising that's unexplained, meaning he was not playing soccer and he didn't fall, or he wasn't playing rugby, he didn't fall. So I don't want to cause panic. It's just unexplained fevers. So if you went up country and there was malaria and he had a fever, that's explained, okay? If it's these unexplained fevers that are recurrent and they're just not explained, you really need to have that investigated, because it could be a malignancy, it could be something with the immune, it could be an immune disorder, it could be something rheumatological. So you do need to have that checked out, right? So it's not necessarily cancer, but you really need to take that seriously. And, you know, unexplained bruising, that you need to take seriously. You know, this very lethargic baby, because that's what kids do. They're supposed to play. So for any child who's not playful, that as a pediatrician, because I am primarily a pediatrician, is a problem. You know, that could point to anything, could be pointing to tuberculosis for all I know. That you should take very, very seriously, because children are supposed to play. That's their job. Okay, so I was talked about like hematological malignancies, and we have our lymph node system. So if you're digging and you hurt yourself in the shamba, you know, you'll have nodes at the top of your thigh. Or if you have a really bad tonsillitis or a throat infection, you'll feel the nodes here. So if you have a scalp infection, you'll feel the nodes. So if you're having these swellings, then you should have them checked out. You should have a pediatrician check them out. And I spoke about hematological malignancies, and then we have solid tumors. And those, I think, are the easiest to pick up, although you'd be surprised. I have kids coming to me with really, really large masses, and, you know, somehow it just got missed. So if you're bathing your baby and you know, but moms know their babies.
Yeah.
They've been with their baby since they were born, right?
Yeah.
So if you're bathing your baby and you feel this mass in the abdomen, you know, just have someone check it out. Might not necessarily be cancer, but let somebody check it out.
Okay.
One very common thing which I haven't spoken about, and the ophthalmologists deal with this a lot, the eye doctors, is we call it a white reflex. Like, you know, when you take a picture and you can see, like if it's at night, there's that red sort of so if you see like a whitish kind of on the pupil, that you should take really seriously.
Okay.
That's, I think, one of the easiest to pick up. Retinoblastoma, again, for some reason they still come pretty late. And then, so I talked about solid tumors, and then I'm putting brain tumors separately, but it is still a solid tumor. So if you have a child saying, you know, they have these headaches, especially if it's associated with vomiting, you should take that pretty seriously, and especially if it's waking them at night. If they're having these gait disturbances or even just mood swings, sometimes they have behavioral problems, or, you know, a child who's just sort of bumping into things, probably because they don't have their peripheral vision. So I'm just running you through a whole 4 years of oncology, but just giving you the basic things that if you see, and moms are really great about it. Moms know, sorry, I'm not being sexist, dads know as well. Let me say parents.
They're closer to moms. You're very right, by the way.
Parents are really good at picking this. Parents will come and they'll say to you, I don't know what's wrong with him. He's just behaving funny.
Weird tendencies.
So, you know, you send him off to get something, and he's, you know, sort of bumping into things, especially if they're losing their peripheral vision, or they're waking up, and, you know, every time they wake up early in the morning, they throw up, they have these headaches, they throw up, and then they're fine. Or, you know, he's got this funny walking style. So those are more the neuro-oncological
Is it a matter of maybe semicircular canals all being affected, because now the imbalance of some sort also coming here? Is it the vision or the semicircular?
So I was talking about like the most common, which is so that's not the most common, but one of the common ones. It's called medulloblastoma. So they come with this sort of gait disturbances, or they have these really horrible headaches. Sometimes they have issues with their vision, sometimes they have issues with their behavior, and it's really easy to miss, especially in teenagers, because you'll be like, oh, he's just being a teenager, you know, but actually they're having symptoms. And then if they're having their face pulling to one side, you know, they're smiling sort of like this, or they're drooling. I mean, those are now later symptoms, and trying not to share the very late things, trying to share the things that are happening a little bit early. So headaches with early morning vomiting, that needs to be taken really seriously. If you see, and again, I really cannot emphasize enough that it could really be anything. There is so much overlap in symptomatology. So if you notice something is off with your child, you really, really must have them seen, and don't sort of rush to say, oh my God, it's a cancer. And the thing is, even if it is a cancer, and really, truly, I'm biased because that's what I do. But I'll say to you, I said in the break, I spent quite some time in Kenyatta, and you know, I've seen the worst of it. I got close to children, and I lost them. But then the book says this, okay? The book says that your 5-year overall survival, you know, without relapse, overall for all tumors, from the really good ones to the really horrible ones, is about 80% in high-income countries. Okay, I understand they probably have better diagnostics, probably better have treatment, but then the gap was so much, and that's why, you know, I'm a stubborn optimist. I'm like, there's got to be something we can do different.
Reality actually.
There's something that we can do different. So I think for me the main message is to, you know, say we need to speak more about these symptoms. We need to tell parents that it's really nothing you did. It's really not preventable. It's not a lifestyle thing for kids, and to really say that it is treatable. I am, as much as I'm an optimist, I'm also very truthful. When we have tumors that are horrible,
Okay.
like, you know, control, you know, if it's gone to the brainstem, which controls your breathing, all your important functions. I had a family I was consulted on, and I was very frank with their pediatrician. I said they need to say goodbye. So I'm an optimist, but then when things are bad, I'll also be very truthful. But those are, you know, the rarer ones. Most of them are actually treatable.
What about Wilms? I think...
Wilms tumor. So that's one of the solid tumors. Sure. It is a renal tumor. It's the most common renal tumor. And then again...
because I know a kid was treated, actually, which is, I think, a good thing. If it's treatable, it's a good thing.
So again, the message is one of hope, and the message is that just as you have different children, and they're not all the same, they're not the same characters. You know, this one will be loud, this one will be very introverted. Children need to be treated uniquely. Don't listen to somebody else's story and copy paste it onto your own life.
Yeah, sure.
Every child needs to be treated as themselves. So, like you've mentioned, Wilms tumor. I don't treat all my Wilms tumors the same, because you'll be surprised, and I don't want to get too technical, that they're not the same. It's not always the same animal. You know, you have favorable Wilms tumors, you have some that are not favorable, and you have to be upfront.
Is it a matter of stages, like Wilms
so
tumor
it's not
stage
just
1?
about the staging. So staging, we use staging for the solid tumors, yes. We use a lot of what we call risk stratification, and it's risk for what? It's risk for relapse. So there are several things that are important. So the stage, meaning how far did it go, and that's the cool thing about kids, right? So even some stage 4s can be good. Like neuroblastoma has a very, very unique thing called 4S, and that's very treatable, and that's great. So it's not like, oh my God, it's stage 4 and you're dead. We're burying you, no. So it depends on the stage, but it also depends a lot on the biology. I can't overemphasize that. You know, if you have, like you said, someone had a Wilms tumor and that was treated. So not all Wilms tumors are the same. Most of them are very treatable, but you really have to, and that's the other thing that I was saying, we need to advocate. I blame myself. I think we need to, so it's easier to just look at what you can do yourself. Is we need to go deeper into the diagnostics of it. So it's a big problem, but I think it's surmountable. And the great thing about I can't overstate it, that a lot of childhood tumors are actually treatable. You know, and it's really about not just the stage, it's the biology, the behavior of that tumor.
Maybe to the parents out there, there must be some sort of you talked about knee-jerk reactions, because sometimes you might just come up and maybe this kid is suffering from X and Y, then you rush to a doctor. The normal process happens from the clinical officer to the doctor, to the whoever, to the nurse, everything, to the pharmacy. Life continues. But looking at regular checkups, you know, you might be so comfortable. Our kids are playing, but still, regular checkups for a kid. Maybe a kid hasn't fallen sick for a long time. And then you're comfortable. Mtoto wangu agonjeki. So, do you think it's also maybe important for parents to be checking their kids all the time?
So it's easier when they're little, because you're bathing them, you know, they come, they hug you, and they want to be around you, and then you get to the teenagers and they're like, you know, putting signs on their door, don't walk in, or, you know, they just don't have much to do and they're stuck to their phones. So it's way easier when they are little, because you're close, you know, you're sort of, you know, closer to them, if I may say so. So the well baby clinics really do help. So, you know, they should go for their, and because when they're little, you know, they're always going for their jabs, and, you know, they're going for their well babies. So I would encourage that. I'm very big on not causing panic. And that's why I've really taken time to sort of discuss the things that you should take seriously when you see in your child. There are clinics, there are adolescent clinics that you can take your child to and just, have them checked out. Take the opportunity when they have a cough and cold and, let them be seen. But if you have your 16-year-old who's happily doing his thing, playing his rugby, you know, going to school, being a teenager, doing his Form 2 or whatever he's doing. And, you know, he doesn't have any symptomatology. Again, don't cause a panic, but if you do have a reason to go and seek care, if you have this child who's lethargic, who's behaving odd, you know, and then I think you can't also overstate the relationship you have with your kids, because if they have, I'll speak about one of my recent patients. Came in, he's 14, he's being a teenager, he had testicular masses. It was very close to his dad, so he told his dad, so thankfully he came in early. And he had leukemia, so but it showed up as a testicular mass, and he was feeling a little bit tired. He's part of Ligindogo, I mean, he was part of a football team, and he was he's an active person, so he caught it pretty. I mean, he was just feeling a little bit off, you know, a little bit homa here and there, abdominal pain. It's very close to his parents. So I think also keeping those lines of communication open, because you know you're not bathing these guys, so you can't follow them up, but keeping that line of communication. Because he was able to come and say, okay, I have this testicular thing. Is this part of growing? Is this normal? At least he was able, and then we were able to catch it early. All right. So before you wind up, as a quick one, treatment, because there are so many types, actually, processes, chemo, all those things. But now the most common treatment, of course you mentioned the most common, but now common treatment, and maybe, you know, sometimes you look at our pockets also. Some insurance companies kind of just wash their hands earlier. Then you're left struggling on your own. So treatment. So treatment is really, really. So do you want to talk about the money issue, or do you want to talk about the options?
It's a broad one. Yeah. So let's just focus on what we can chew right now, because
what we can chew right now. So there are different modalities for treatment, right? So the most common, and I think everybody knows, is chemotherapy, radiotherapy, you know, then surgery. So what I tell my teenage patients is, I say, well, we can poison it because it's bad. We can poison it, and that's chemo, or we can cut it out, which is surgery, or we can burn it, which is radiotherapy. So because I spend a lot of time with children and
so
teenagers, so that's how I put it. But you know, if I put it as a doctor, it would be chemotherapy or radiotherapy, and there are different modalities. There's a lot of precision medicine now in the West. I was lucky to spend time at Dana Farber and in the Children's Cancer Hospital in Egypt. So there's a lot of precision medicine where you can actually go and target that abnormal, what made this cell go crazy in the first place, and start just dividing. So there is precision medicine, which is not here, unfortunately. There are some targeted therapies, and I think for the people out there who have had leukemias, a specific kind of leukemia called CML, there are what we call tyrosine kinase inhibitors. Don't want to get too technical, but there are some targeted therapies that are available here, but most precision medicine isn't. So we're sort of doing a broad, you know, not very intelligent, might I say, way of doing it because of the toxicity. Because,
Doc, thank you so much. Because of time, I just appreciate your presence today. I know you're not a media person.
No, not at all. But I said I need to come.
Thank you so much for coming.
I need to advocate for the babies.
Sure, a really insightful conversation, because I think now it actually goes back to the parents. They need to know what they're tackling. They need to know the signs, the symptoms, because you get sometimes you receive or you get these kids very late, is it?
Can I say one last thing?
Absolutely, sure.
To the parents who are watching, and for those people who have relatives who may, or friends, there is hope. That's my biggest thing that I really, I mean, if you forget everything else I said, really there is hope. Children are not small adults. They really are very resilient. They are very resilient creatures, and there really is hope. It's not like a, you know, like the way HIV was before. It's like, oh my God, you have HIV, you're dead. Let's plan for your burial. There is hope. There are some really nasty tumors, and there's not much we can do yet, but there's a lot of research going on. But there's a lot of hope. That's the last thing I want to say.
All right. Thank you so much, Doc, for coming.